Hi, good evening all. Good evening, good evening. We are live on Facebook. And I just want to say welcome, welcome. Thanks for joining us tonight. I can see a couple of persons on. If you just click like, share, or send a message to us so we know who is on, so I can acknowledge your presence. Thank you for logging in. Thank you for joining us. Thank you. Thank you. Welcome. Click like and share. Let your friends, your family, your cousin, your neighbor, let everybody know that we are live and we are ready to start. Thank you so much for joining us tonight. Thank you so much. Yes, so tonight is our final episode actually on Say It Loud with Eve, and we're going to be concluding our discussion on menopause. So we're doing part 2 on menopause tonight. But before we proceed, I want to say thanks to everyone who've been so supportive, so encouraging. Thank you for your comments, your questions, your feedback, and for your overall interaction on Say It Loud with Eve this season. I'm very happy that we have made some very positive impact. And this is what the show is about. We inspire, we inform, we share, we educate, you know. I just want to say thank you so, so much. Thank you. It wouldn't be possible without you. I know the conversation on menopause continued since our last discussion. And, you know, tonight we would encourage you to get your pens and paper out to take notes from our guests tonight, who will be sharing some very practical and useful information, useful tips that can revolutionize your life or your everyday way of living, you know. Yeah, thank you. Thank you again. It's not, I always say this, it's not that you have information, it's what we do with the information that we have that will make a difference to us in our lives or in the lives of other people. All right. I have 2 special ladies with me tonight who will be sharing, and I'm very, very happy to have them on. I have Lucille Fifield and Joan Cornwall with me tonight, and I'll ask them to introduce themselves in a little bit. I'm very grateful to these ladies for coming on tonight. I know they've had a busy season themselves, and they've taken time out to help me out tonight, and I'm very, very grateful, as I've expressed to them personally. Without any further ado, Lucille and Joan, I'm going to ask you to introduce yourselves. Tell us a little bit about you, what you do, your background, and, you know, how we're going to proceed tonight. And, you know, before we get into that.
Okay, thank you. Thanks, Eve. So I'm going to ask Lucille to introduce herself.
All right. Thank you, Eve, and thank you for giving us this opportunity to talk on your platform. So as you said, my name is Lucille Fifield. I'm the health director at Manor House Health Education and Wellness. This is a wellness centre where we provide health through natural remedies, and we have been operating for some time. It's the only one in the UK at the moment. Wow. And we see people come to us as a day clinic, or we've just finished a 10-day residential program, and it's been amazing to see the transformations that have been happening with people. We deal predominantly with lifestyle diseases and lifestyle issues. And it's interesting that just recently we had one lady who has come to our program, and she was suffering from the effects of menopause. But my background, I'm a registered general nurse. I'm also a registered health visitor. I also worked as a senior director in the National Health Service. I was up in Stockport, and I was Associate Director for Children and Family Community Health Services. I have a background in public health. I've got a Master's of Public Health, and I also have a MBA, a Master's of Business Administration. as well. So I come from a clinical background, but also from a managerial background. And that is how I'm bringing my skills and running it in Manor House.
Thank you. Thank you so much for that, Lucille.
Yes, and I'm Joan Cornwall. So having worked in the NHS for 17 and a half years, and not as colourful as Lucille's background, but I started from the ground and worked my way up. And so most of my time in the NHS was in the management side. So I've seen the NHS from the ground going up, and you do see quite a lot. Yeah. But on leaving the NHS, I decided that I wanted to go more into the naturopathic way. And that is why I studied herbal medicine. And I'm, pleased to say that Lucille must have seen something in me, because I actually work at Manor House as centre manager. And I have to say that I echo a lot of what Lucille said about Manor House. We see people coming in, and they come in with hope, and they come in to kind of try to get themselves off medication. We don't tell them to get off medication, of course, but they want to try and find a more natural way of managing their health. Yeah. And we are so happy to say that anything that they've learned, they could see the application, and we have seen great results. And we are very pleased, and thank you so much for offering this platform to us.
You're most welcome.
And I to share a lot of what we get very excited about. We eat.
I realize that I get a buzz from you too, and from Danella as well. So thank you
so much, because we're actually breathing it every day, and so we want to be living testimonies to those, to your viewers, and hopefully they'll gain something from tonight.
Yes, thank you so much. Thank you for being so willing and so keen to share. And you know what I always say to my guests, and it will not be, I can promise you that I'll have you back here at some point in time. And I'm sure you're not going to say no as long as you have the time.
Okay.
So thank you both again.
All
right. So our last show, we heard from an obstetrician and gynecologist, and from a lady that does, she specializes when it comes to menopause, actually, Pamela Windle and Dr. Abiodun Fakakunde. And they spoke in detail on menopause and sort of laid the foundation as to the medical side and partially the naturopathic perspective as well. And tonight we want to explore this approach, the alternative approach, a bit more. We know that not every woman, not every female will use HRT. And a lot of females do struggle for various reasons. And people, if once they have the information and know that there are options out there, they will use alternative approaches. Some are suffering in silence, unfortunately. But help is available to help deal with menopause, or the menopause as we call it, right? Right, so tonight our discussion will take the form of a presentation from our guests, and we're going to be focusing on, I put them in broad headings: nutrition and menopause, hormonal balance, some weight loss strategies, management of symptoms, and management around sleep and stress. All right, so I'm going to turn over to Lucille and Joan at this time, and they're going to start with the presentation, and after which we'll have a brief discussion and take some questions from our audience. And can I ask you, if ladies or men, if you have questions that you do not want to post in the open chat on Facebook, please feel free to inbox me, message me. If you have my personal mobile number, for those who know me, send me a message, and I'll ask it anonymously on the panel so that your questions can be answered. Use the opportunity. Use it, it's free. All right, thank you. Ladies, over to you.
Thank you very much, Eve. So, so ladies, we have to say we are a beautiful creation by God. And we do move through various stages in our life. And of course, there is a stage called the menopause. So let's understand that as we move through different stages of our lives, there are anatomically and physiologically different stages or feelings or emotions. We change physically, we change mentally, we change emotionally, we change socially, and we also change spiritually. So it's important for us to know what we can do at each stage to help us move through them as gracefully as possible, achieving what we would like to achieve. Why is it important to understand what you can do or achieve, what you desire to achieve, what your body needs? So as we move through different stages of our lives as women, it is important for us to understand our body and what it actually needs at the specific stage, and actually what is coming next. What is coming next? So from conception, your gender is determined. Infancy and childhood, there is general growth, is there not? And then we come to the puberty stage, the hormonal spurt for a young woman. Then we are at the reproductive age. Our body is ready for production. Our body is ready to conceive and have a child. Then we come to the perimenopausal stage, which means that our body is actually sending out signals that we are winding down. We enter into the menopause. So of course we know that there are hormonal withdrawals. We will produce less estrogen. And then we have the postmenopausal stage. That is the stage where we are no longer reproductive. Our body will no longer be able to bear children because our hormone levels have changed. We are not producing estrogen anymore. And what we're going to look at this evening is the perimenopausal stage, the winding down, the menopause and postmenopause. And it's important to understand that those are the three stages that we may go through. So what is the menopause? It's the time that marks the end of our menstrual cycles. It's diagnosed after you've gone 12 months without a menstrual period. Menopause can happen in your 40s or 50s, but the average age is 51 in the United States and of course in the United Kingdom. Menopause is a natural biological process, but the physical symptoms, such as hot flashes, emotional symptoms of the menopause, may disrupt our sleep, lower our energy, and affect our emotional health. So there are many effective treatments available, from lifestyle adjustments to hormone therapy, and Eve actually touched on the fact that, we looked at the conventional and touched on some of the naturopathic, interventions that are out there. So would you believe it, ladies? There are at least 34 different symptoms. For those of you who are listening, for those of you who may see this, going from hot flashes, night sweats, irregular periods, mood swings, memory lapses, disrupted sleep, hair loss, unfortunately, is one of the symptoms of the menopause, or outcomes of the menopause. Decreased libido, headaches, breast soreness, muscle tension, gum problems, tingling in the extremities, itchy skin, fatigue, depression, irritability, even body odor, panic disorder, osteoporosis, and I didn't even name the 34. So those are some of the symptoms. And ladies, if you're out there and you are feeling any of these, then there is hope, is what we're saying. There is actually hope. So let's move on. Menopause can result from a natural decline of reproductive hormones. As you approach your late 30s, your ovaries start making less estrogen and progesterone, the hormones that regulate our menstruation, and our fertility starts to decline. So in your 40s, your menstrual periods may become longer or shorter, heavier or lighter, and more or less frequent, until eventually, on average, we enter into the menopause. We stop producing eggs. So, there's a hysterectomy that can bring on premature menopause. A hysterectomy that removes your uterus but not your ovaries usually doesn't cause immediate menopause. Although you no longer have periods, your ovaries still release eggs and produce estrogen and progesterone. Then you have chemotherapy and radiation therapy. These can actually give you premature menopause. So these cancer therapies can induce menopause, causing symptoms such as hot flashes during or shortly after the course of the treatment. The halt to menstruation and fertility is not always permanent following chemotherapy, so birth control measures may still be desired. These are looking at the, the premature onset of menopause. Primary ovarian insufficiency. So about 1% of women experience menopause before the age of 40. Menopause may result from primary ovarian insufficiency when your ovaries fail to produce normal levels of reproductive hormones stemming from genetic factors or autoimmune disease. So after the menopause, your risk of certain medical conditions increases. What are these? Heart and blood vessel disease. Your risk of heart attack increases. So when your estrogen levels decline, your risk of cardiovascular disease increases. So heart disease is the leading cause of death in women as well as in men. So it's important to get regular exercise, eat a healthy diet, and maintain a normal weight. I said normal weight. Ask your doctor for advice on how to protect your heart, such as how to reduce your cholesterol or blood pressure. So that is one of the effects of the menopause. You will stand an increased risk of developing heart issues, ladies. Osteoporosis. So this condition causes bones to become brittle and weak, leading to an increased risk of fractures. So during the first few years after the menopause, you may lose bone density at a rapid rate, increasing your risk of osteoporosis. So postmenopausal women with osteoporosis are especially susceptible to fractures of the spine, hips, and wrists. You may have urinary incontinence. So as the tissues of your vagina or urethra lose elasticity, you may experience frequent, sudden, strong urges to urinate, followed by an involuntary loss of urine. So that's called urge incontinence, or the loss of urine with coughing, laughing, or lifting, which is stress incontinence. And you may have urinary tract infections more often. So we would say strengthen your muscles by doing pelvic floor exercises. And using a topical vaginal estrogen may help relieve symptoms of incontinence. And then there's something called HRT, hormone therapy, may also be an effective treatment option for menopausal urinary tract and vaginal changes, which can result in urinary incontinence. You may lose the ability to feel sexual, or you'll lose sexual function because of vaginal dryness from decreased moisture production and loss of elasticity, which can cause discomfort and slight bleeding during sexual intercourse. Also, decreased sensation may reduce your desire for sexual activity, or your libido decreases. And then there's weight gain. Many women gain weight during the menopausal transition, and after the menopause, because your metabolism slows down, so you're not burning calories as efficiently as you would do when you were before your menopause or even younger. So you may need to eat less and exercise more. So you need to shift the balance a little just to maintain your current weight. So the perimenopause is more or less at the age of 35 to 50 when your body's getting ready. What needs to be achieved: comfortable transition into the menopause, limit uncomfortable symptoms, hot flashes, mood swings, and sleep disturbance, and accept that you are entering into the end of the reproductive phase of life. So there's a lot of self-management there, ladies. Now, you may feel vulnerable at this time, feeling of personal change emotionally, anxieties, irritabilities, your body's changing, you'll start to gain weight, your skin may become more spotty, you're more fatigued, you have low libido, you'll notice some hair loss, your hair is starting to thin, you'll start to feel a lot of aches and pains, stress, mental challenges, forgetfulness, difficulty concentrating. You may even experience some digestive disorders and hormonal imbalances, and of course, infertility. So at this stage, understand the changes, and accept it. And then you can actually go into the nourishing foods, which we're going to go more into in the latter part of the presentation, but go into calcium-rich foods, because we're saying you'll start to lose calcium, you're more susceptible to osteoporosis. So the calcium-rich foods are like your broccolis and legumes, iron-rich foods such as green leafy vegetables and nuts and seeds, and the healthy fats such as olive oil, coconut oil, and avocado. Also whole grains for high fiber, probiotic-rich foods and raw fruits and vegetables. Avoid spicy foods and refined sugars, processed foods, and also caffeine and alcohol. And like I said before, we're going to go more into these in a bit later or later in the presentation. So when you're in the menopause, it's around 50 to 60 years old. So there is a cessation of vaginal bleeding. Now, if you do see any spotting, or you do find that there's vaginal bleeding, you do need to see a doctor just to see what's going on there, because there should be a cessation, meaning no bleeding at all. So there's an acceptance that you've reached the phase of your life where you're no longer able to, have children or produce children. So there is a balance between living fully and inevitably of death. So which one would you choose? Living fully, of course. Osteoporosis, heart diseases, depression, changes in vaginal health, distress over a changed body, your energy and limiting abilities, fear of sickness and death, uncertainty, maybe about financial needs and the care that you may need, losing your spouse. Some women may lose their spouse at this time in their life, and peers and neglect by the children with loneliness. Your children have flown the nest, so to speak. And there's reflected sadness about a wasted life. Now, this sounds so depressing, ladies, doesn't it? Between the age of 50 to 60. But there are ladies who start to embark on, fantastic things. They may want to do another degree. Some of them may want to become a doctor at this age. They find that, wow, this is freedom for me. The children have flown the nest. I find myself on my own in the house. I'm going to do things positively. So a lot of people just grab it and they say, this is wonderful. I'm going to do something extra special for me at this time. And then menopause and beyond again, there's an acceptance. Like I said, you can accept it and embrace it and go gracefully through it. Or you can just, just say, well, shrug your shoulders and say, well, actually, it's the menopause now. That's it for me. Absolutely not. So you can, again, eat more of the calcium-rich foods. I've mentioned that before. You need plenty of water, sunlight, exercise. Eat nourishing herbs like ginkgo biloba, milk thistle, bilberry. Then you've got grounding teas like ashwagandha tea, turmeric tea. And then there's a lot of self-care, time to rest, relax, recreate. It's excellent. Have nourishing skin baths. Be mentally active. Journal, start a diary even. Care for your family and relations. It's a time to embrace. It's a time to embrace. So menopause requires no medical treatment. Instead, treatments focus on relieving your signs and symptoms and preventing or managing chronic conditions that may occur with aging. You've got HRT. So estrogen therapy, I'm sure that was mentioned, Eve, at the previous presentation. Yes. So, some women go for HRT. So estrogen therapy is the most effective treatment option for relieving menopausal hot flashes. We're looking at it from a naturopathic, but there's no reason why we shouldn't mention it briefly here. And so it's depending on your personal and family medical history. Your doctor may recommend estrogen in the lowest dose and the shortest time frame needed to provide symptom relief for you. Then you've got something called vaginal estrogen to relieve vaginal dryness. Estrogen can be administered directly to the vagina using a vaginal cream, tablet, or ring. And this treatment releases just a small amount of estrogen, which is absorbed by the vaginal tissues. And it can help relieve vaginal dryness. Then you've got low-dose antidepressants. So certain antidepressants related to the class of drugs called selective serotonin and reuptake inhibitors may decrease menopausal hot flashes. A low-dose antidepressant for management of hot flashes may be useful for women who can't take estrogen for health reasons, or for women who need an antidepressant for a mood disorder. Then you've got something called gabapentin, is approved to treat seizures, but has also been shown to help reduce hot flashes. So we're talking about reducing the effects of hot flashes. A lot of women find it very uncomfortable to go through the menopause. Some women, it's like a shrug of the shoulder. Oh, was that it? Okay, I didn't even notice. But some women, it can be debilitating, and it also takes maybe their life away. They not life away physically, I'm talking, but it's like they're not able to do the things that they normally do. And they get embarrassed when they're standing in front of an audience, and then you see beads of sweat and you start to see the sweat pouring down their face. This drug is useful in women who can't use estrogen therapy and in those who also have nighttime hot flashes. Then you have clonidine. Clonidine, a pill or patch typically used to treat high blood pressure, might provide some release from hot flashes. So as you can see, there seems to be a theme where there are specific medications that could help reduce hot flashes or provide some relief. And Lucille will be touching on it in a shortly, about some of the natural things that you can use and take to reduce the hot flashes. Medications to prevent or treat osteoporosis, depending on individual needs. Doctors may recommend medication to prevent or treat osteoporosis. Several medications are available that help reduce bone loss and risk of fractures. Your doctor might prescribe vitamin D supplements to help strengthen bones. So there are some herbal approaches to treating the menopause. And Lucille, did you want to interject here with regards to some of the herbs and natural approaches?
Well, there are many herbs that we can use, but normally the approach that we tend to do is look at the cause, because one of the key things that you did mention, Joan, is that this is a natural biological process. The menopause is natural, that is a natural process that we go through. Yeah. You know, when we are girls and we go have a period, we don't have any problems. And equally, when we stop having periods, we shouldn't have any problems either. And so what the menopause just highlights to us is that for the number of years that we've been having periods, we're not been fully looking after our bodies. And the menopause just highlights the fact to us that our lifestyle when our menopause stops, when we have a menopause, it highlights to us that our lifestyle is not good at all. So our process is really examining our lifestyle. What factors, what habits are we implementing that is causing us to experience one or more of those 34 symptoms that you mentioned on your slide. So that is our approach. So one of the first things that we do is we sit down and have a consultation with the person. And one of the very first things I would do, I would ask women, if you're having hot flushes, how much water are you drinking? Yeah. And that's the very first thing that we start looking at. Oftentimes, women, we're not drinking enough water. We're drinking tea, we're drinking coffee, we're drinking sugary drinks. All these drinks are dehydrating. And it seems counterintuitive that because we're not drinking enough water, we're getting hot and flushing and sweating a lot. But oftentimes when we start drinking the right amount for our health and for our weight, and we drink it over a period of time, 2 to 3 weeks. In fact, we've seen it in a couple of days when women start drinking the right amount of water, that their hot flushes reduce significantly. And oftentimes when we have a hot flush, it's a sign to us, you know what? Have you been drinking enough water that day? It's a sign that we need to drink more water. And if you think about it, if we are suffering from chronic dehydration, yeah, we haven't been drinking enough water for many, many years because we've got careers, we may be mothers, we're working different shifts, we're involved in church and all different things. We don't focus on drinking enough water. Our bodies start making adjustments to sort of minimize that chronic dehydration. So when we go into menopause, we may find that we start getting vaginal dryness because we're not drinking enough water. And if we just start drinking water, that will help to rectify the vaginal dryness. It may help to rectify the hot flushes as well. So that's one of the very first things that we start looking at. How much water are you actually drinking? And it has to be water. It cannot be anything else. The next thing we would look at is what's your diet like? What kind of foods are you eating as well? If we eat certain foods, it's going to predispose us more to things like osteoporosis. You know, if we're eating a high amount of animal-based foods, or we're drinking a high amount of milk and dairy products, you know, that's going to increase the amount of calcium that's going to be leached from our bodies. Now, one sign that we may have calcium deficiency, a woman, what they can do, just look at your nails. You know, look at your nails. Are your nails smooth? Are your nails strong? Or do they break very, very easily? Or have you got little ridges? Run your fingernail over your nail. Do you have ridges on your fingernails? That's a classic sign that, you know, women are nutritionally deficient because they haven't been eating the right food for their bodies. So that's really important that you mentioned green leafy vegetables, Joan. So that's crucially important that we eat those green leafy vegetables. You know, herbs are for the service of man. Those are the things that we should be eating. But not only herbs, we've got pulses as well. You talked about mental depression and going on mild antidepressants. Do you know that if we eat lentils, the basic lentils, you can get red, you can get green, you can get black lentils. Lentils have a small amount of lithium, which helps to lift your mood. So eating those pulses and those legumes are so helpful for our bodies as well. And it counteracts a lot of those other 34 symptoms that we may experience going through the menopause.
And Lucille, would the legumes and so on, would these be classified as, you know, this term phytoestrogen?
Well, the phytoestrogens are plants that have those plant estrogens. So, for instance, you know, you're looking at soy, you're looking at tofu, you're looking at miso, you're looking at tamari sauce. So if you look at some of those populations, like in Japan, you know, they don't know what the menopause is for them. You know, they just stop the periods and they don't have all these symptoms that we in the Western world tends to have. And even in some parts of the continent of Africa, you know, women just go into the menopause and do not experience all these symptoms. The menopause highlights that the menopause highlights, and when we have all those different symptoms, that we have been neglecting our body. And so for women, what we need to be doing at that stage is pausing, stop, slow down, take time out and start looking after yourself. Eat those phytoestrogens, you know, eat those lentils to help your mood. Drink more water. Another thing that we can do as well is how we are dressing. How we are dressing is so important. Within our approach at Manor House, we say in order to have perfect health, there's 3 things that you need. You need perfect circulation, that's the first one. You need to have temperance, and you need to have love, joy, and hope. So the perfect part, the perfect circulation is all about the physical part of our bodies. The temperance is about the mental side of things. And the love, joy, and hope is about the spiritual component. So in order to have perfect circulation and go through the menopause without any problems, we need perfect circulation. And if we are not dressing appropriately, then our circulation is not going to be, what's it called again? Won't be flowing well through our system.
Right.
Yeah, so for instance, we're in the winter months,
Yeah.
and we're still wearing tank tops and shorts. You know, we are not dressing appropriately, and we're more likely to have ill health because our blood is not working well. So it's important for us as women going through the menopause that we dress appropriately for the climate and for the work that we do. We ensure that our arms and legs are well covered during the winter months and the autumn.
So nothing too tight or too constricting.
Absolutely. You know, you know, there's a return of the corset. You know, I don't think it ever went away, especially when our sisters are slightly bigger. Some of them will like to have a nice shape, and they wear these corsets that holds everything in. But while they're holding everything in, it stops you breathing properly. And we need to be getting a good respiration, breathing in deeply, getting the oxygen into our lungs, into our blood, so that that blood can feed every aspect of our body. And it also impedes the digestion when we have got tight things as well. One of the areas that a lot of women are concerned about is vaginal dryness, especially if they are in a relationship, they have a husband as well. That is one of the big concerns that women have, that now they've gone through the menopause, the relationship that they're having with their husband or their partner is difficult. It is painful. I know Joan touched on it, that vaginal dryness. But and you say clinically you have a relation and then you have slight bleeding, but it causes a lot of pain for women. And so many women may go to the GP, and the GP may prescribe a HRT, vaginal pessary, to help relieve the symptom of vaginal dryness. But you know, drugs, so every drug that we take has a side effect. Every drug. If a drug doesn't have a side effect, then it is not a drug. And the only difference between a drug and a poison is essentially the dose. So from our perspective, we do not work with drugs, and we seek natural remedies to deal with vaginal dryness. And there's things you can buy from the chemist over the counter, some creams and lubricants, which are water-based, that you can use. I know many women have mentioned these have very little side effects because they're just essentially water-based in a gel, which you can apply to the vagina. But also a simple remedy is like a water treatment that you can apply to that area. I brought some ice with me here, the simple ice cube, yes? And if women have vaginal dryness, just pop in a little ice cube in the vagina before you come into a relationship, relations with your husband or wife. Pop that in the vagina, let that melt, and that cools it down, and it makes it not as painful. And after you've had that relationship with your husband or your partner, take another ice cube and pop it in. That is hydrotherapy internally, and that cools the vagina down, because we're talking about friction. There's no moisture there, there's no water there. And the friction inside the vagina causes pain and discomfort. So just use that ice cube. It is a powerful, so simple remedy, but powerful, no side effects. So that is one approach. Another approach you can use as well to do is hydrotherapy for women is trying to get the blood flow to the vaginal region. So if a woman's in the shower, she applies hot and cold water to the vaginal region, the perianal region. So you would get your hot shower head and spray between your legs, warm water. You make sure you don't burn yourself. And you spray between your legs for about 3 minutes, warm water. And then you turn it right down to the coldest setting and spray cold water for 30 to 1 minute. Then you do that again, hot, cold, hot, cold. So 1 minute, 30 seconds, 1 minute, well, I'm getting it wrong, 3 minutes, 30 seconds, 3 minutes, 30 seconds, 3 minutes, 30 second cold, and you always finish on the cold. And that is another way of bringing the blood supply to that region. And as you bring the blood supply to that region, the blood brings the moisture and the water to it as well. So women should try doing that, and they need to continue doing that. You're not going to get an overnight improvement, but if you continue doing that treatment for a few weeks, you will definitely see an improvement in the area of vaginal dryness.
Yeah.
But the ice cube is excellent if you want to have a quick fix as well. So those are some things that women can do as well. And in the same way, you know, we women, especially women of the African Caribbean background, we have a thing about our hair, and we're so concerned about our hair. And when our hair starts thinning, that causes us a lot of concern. And the same way that we use the hot and cold hydrotherapy, we can use hot and cold to our scalp as well. So if our hair is thinning, what we want to do, we want to bring the nutrients in the blood. We want to bring the oxygen in the blood to the scalp. And so the same way you apply the hot shower to your scalp for 3 minutes, and then turn the shower down and apply cold, freezing cold, and the scalp can take that cold really, really well. And then you do it again, 3 minutes, that cycle, 3 minutes hot, 30 seconds or 1 minute cold. You always finish with a cold. And when you come out the shower, what you will feel, you feel a tingling in your scalp. And that tingling is the blood bringing the oxygen, bringing the nutrients, the protein, the glucose to the scalp as well. And that helps the hair to grow back. Again, it's not an overnight solution, but if you persist with that natural remedy, over time you see a thickening in your hair. Obviously, if you have your scalp damage from perms and traction alopecia, and if your hair loss has been going on for some time, you may not get the results that you are looking for.
Yeah.
Thank you, Lucille. Thank you.
Thank you. Okay. Yeah.
So we've mentioned, and Lucille, thank you so much for that important information there. You can also eat a lot of vegetables from the cruciferous family. We've mentioned broccoli, full of calcium. Brussels sprouts, not everyone's favorites, but Brussels sprouts is absolutely amazing. Cabbage, cauliflower, kale, turnips. These are the things that we should be eating quite a lot of, ladies. And also try not to eat some of these raw, and know that you can just make it slightly tender using maybe boiling water. You can put them in a bowl and then you pour the boiling water over it and cover it, and that will actually soften them somewhat rather than eating them hard and raw. So these may help your body make substances called endols, and these help protect women from dangerous effects of excess estrogen, among them breast cancer. Plus, they are all good sources of vitamins and fiber. If you eat them without cheese, they are all low fat, because obviously a lot of people like cauliflower cheese and cheese on those things. But yeah, we don't condone the eating of cheese. Or if you do, it would be really, really good if you could try to reduce that.
Yeah.
Other excellent foods: whole grains, garlic, sesame seeds, whole grain pastas, sunflower seeds, flaxseed, raw fruit and vegetable juices, and brewer's yeast, lecithin, kelp, and cold pressed vegetable oils. And your diet should be at least 50% raw. I know that you can actually go to 80% raw and 20% cooked. So mountain evidence suggests that getting enough of certain vitamins and other nutrients can make menopause a breeze. And now we come to the questions. Eve, we are more than happy to answer questions.
Yeah. One of the things I wanted to just say, you know, women need 5 to 7 times more minerals than men. 5 to 7 times more minerals. So from the time a young girl goes into puberty, even before she starts her period, she needs 5 to 7 times more minerals. And then if she has a baby, I always say like a baby is like a little parasite, taking out everything from the mother. Then her, woman's resources of vitamins and minerals are reduced. So if you have a man and a woman eating the same foods every day for a number of years, that woman will get sicker far quicker than that man, because a woman needs 5 to 7 times more minerals than a man. So it's so important, and because a lot of our food are minerally depleted, especially if we buy them from the shops, it's better if you grow them your own. Our food is minerally depleted, that we supplement with minerals. And one of the minerals that women need by weight and volume more than any other mineral is calcium. Yes, and it's not just any calcium, there's various calcium. It's not just calcium carbonate, you need a mixture of different types of calcium. You know, calcium gluconate, calcium carbonate, calcium citrate. So a mixture of calciums that you can take. And then after that, you would need magnesium. So sometimes when people get tingling extremities and electric shock, it's because the mineral balance is not quite right. So that's one of the important things that we need to mention, that women should start supplementing with minerals and also taking vitamin D as well. I know Joan mentioned that as well.
Yeah, I'm just thinking on that, maybe ask 2 questions in one. Just in following up what you said about the need for calcium in postmenopausal women. Do you, I hear you say what you do at Manor House, but apart from, say, sitting with the client and taking the history, are there any kind of diagnostic tests that you do that will help you kind of narrow down to find out what the exact problem is? You know, they may have been having the hot flash and other symptoms, but what exactly is causing this? And how do you identify that apart from the history taking?
Yeah. So one of the things that we have to make clear is that we don't diagnose.
Okay.
What we work for, we try and identify the cause of people's conditions. So one of the, what we do body chemistry assessments. So we do a number of tests which can be done in the NHS laboratory, but we have the equipment which we do at Manor House. So we've been trained to do that, and the tests are done on the urine and on the saliva, and we do 7 tests. Okay. And then based on those 7 tests, we can identify some of the habits that we have that have caused some of the problems that women are experiencing going through that natural process of menopause. So I just want to emphasize a little bit more. The reason why we don't think about diagnosis is because I explain it like you come downstairs in the morning, you see water on the floor in the kitchen, and the first thing you would do is, all right, water's on the floor in the kitchen. Did I drop something the night before? I would mop it up. That's what most people do. You mop up the water.
Yeah.
The next morning you come downstairs, you see water on the floor. What would you naturally do, Eve?
If I see water on the floor?
The second time, the next morning.
Okay, I don't want to find out where it came from.
Exactly, and that's what we
the first time.
Absolutely, we'll try and identify the cause. Is there a leaking tap? Is there a faulty washer?
Hence my question right here. So
Yeah.
what do you do to find out where the water is coming from?
All right, we do the body chemistry assessment. That's what we do at Manor House. So we do a number of things. We do a consultation, which many of the things which are done at your GP practice. Yeah. We do the body chemistry assessment, and we also do other tests as well on the health desk. So my background, as I said, I'm a registered nurse, and I use my clinical skills to do that, as well as the body chemistry assessment. And from those three areas, we can identify some of the habits that people have that have contributed to their condition. Mm-hmm. And there are so many habits, and a lot of the habits stems from how we eat, mm-hmm. and what we eat, and when we eat as well. Yeah.
Yeah. Right. You spoke about hot flashes and some other symptoms earlier. I group them, you know, for example, you have the vasomotor symptoms like the hot flashes, the night sweats, and so on. And you do mention about keeping hydrated, mm-hmm. and how you rehydrate different parts of the body, you know, and the whole body. But in terms of psychological symptoms, the mood changes, the irritability, the depression, and from a non-hormonal treatment perspective, what advice would you give to someone who is experiencing the psychological side effects of menopause? How can they deal with the lack of sleep, the depression, the mood swings, from a natural perspective? Are there any foods or anything that can help? Exercise, etc.
Yeah, absolutely. Exercise is important. And one of the things that we encourage women is walking. Walking is so important. So what we would say, incorporate walking in your lifestyle. Yeah. If people want to go to the gym, that's fine. But oftentimes as women, we overdo it. So mm-hmm. walking after a meal, we call it the digestive walk. Walking in the country, in the open air, in a park where there's plenty of trees and greenery is so good for the mental health. We also encourage women to read positive books. One of the books that we tend to give to our health guests is called The Power of Hope. The Power of Hope, how to deal with depression, which is excess past, how to deal with stress, which is excess present, and how to deal with anxiety, which is excess future. So we give this book, it's a powerful book. We talk about some of the techniques that women can use and incorporate into managing that. We also have what we call the Love, Joy, and Hope sessions, where we sit down, we give women an opportunity to talk about some things that women have experienced, because oftentimes we go through the menopause. It brings back things that have happened in our past, and also things that, we feel that we may have not achieved certain things as well. So it gives women an opportunity to talk about some of these things rather than bottle it up inside them as well. Yeah. But also the way we are eating is crucially important. One of the tests that we do is look at the sugar levels in the urine. And oftentimes, if we are eating frequently, grazing through the day, the glucose, we call it reactive hypoglycemia, where you go that high and low, because we're constantly eating through the day. That has the most impact on our conscious and subconscious feeling of well-being. So it's really crucially important that women get under control the way they are eating, because if they're not eating correctly or having good eating habits, it's going to affect their feeling of well-being. Yeah. So that is crucially important as well. And the foods that they're eating as well, we try and push them towards a whole food, plant-based diet. We don't promote veganism, because some of the vegan foods are far worse than meat.
Yeah,
and sometimes, you know, I'm whole food plant-based, and I'm saying to people, sometimes it's better to eat the meat than to eat the vegan processed man-made foods and man-made analogs, you know, because our body just don't know how to deal with them, with those foods, and the body doesn't recognize it either. So we encourage people to eat a whole food, plant-based diet, manage your eating habits when you're eating, try and eat between 6 and 8 o'clock in the morning, because between 6 and 8 o'clock, that's when the potency of the insulin is the highest. You know, we try and eat within that 24-hour circadian rhythm, and try and stop eating by the latest 4 o'clock. And importantly as well, we need to go to bed on time, you know, because 9:30, we're normally in our bed, all right? And we're trying to get that melatonin that is released, and which helps our brain recover. Yes, the melatonin is so important for our brain health. So those are all those different aspects that we can look at in order to help the emotional side of our bodies.
Yes, and I want to just add to that bit as well, and just from a general point of view, just to say, take time out. Just take time. A lot of, you know, because of how life is at the moment, varies for everybody. Some people work in very stressful environments. And, you know, I guess you'd have to establish that relationship with your boss to say, look, I'm not myself at the moment. Just give me some time. Just take some time out for yourself, and do some kind of what they call it, mind, you know, do some thinking outside of work. Read, like Lucy said, walk. It relaxes you, you know, and also helps with the release of these neurotransmitters in the brain that helps to boost the mood, the serotonin that you mentioned earlier as well. But just take time. I don't think a lot of us take time, take a holiday, take a weekend away. Well, not right now, given COVID is, you know, a lockdown. But take time, very, very important.
And sorry for interrupting you, Eve, but I was thinking, when we think of the word menopause, it's a time for women to pause, take time out, pause, stop. You know, people think, many of women think, oh, the menopause come, I can do far more. No, pause, start looking after yourself, you know, reflect on your life, reflect on where you want to go as well. So I totally agree with you, Eve. We need to start pausing and looking after ourselves. You know, I've never met Superwoman yet, and many of us women think that we can be Superwomen.
Yeah, you did mention, and this is for both of you, you mentioned about eating, well, a lot on nutrition. And one of the things that was flagged in the last session was that as we approach, say, 40 and above, this is when we're at higher increased risk of diabetes, high blood pressure. Naturally, we have the middle age spread. We have, you know, all kind of life changes happening physically and otherwise from that age 40 in females. So we are more susceptible to all of this. And menopause on top of that kind of increase the risk for cancers and things like that. I know Dr. Abiodun used a slide last week where he showed that the risk for cardiovascular ill health, heart attack, in postmenopausal women being much higher, especially if they are obese. So it's very, very important that we look at what we're eating, choose the right food, plant-based, etc., but choose the right things to eat in the right proportion, because that's another thing, portion control, you know, small frequent meals in the right proportion, in the right amounts, and at the right time.
Okay.
Very
Yeah. I agree with you there, you know, because what we're talking about is a metabolic syndrome where people have that visceral fat, that fat which is around their organs, is in their liver, so people can have cirrhosis of the liver without even drinking alcohol, fat in the blood vessels and fats in the cells, and it predisposes us to insulin, but you don't have to have it. Yeah. You really don't have to have it. And one simple solution, well, two, in fact, is going on a plant-based diet, one. And the second thing is, rather than having small, frequent meals, is following intermittent fasting. Yeah. Research has shown that if you follow a 2-meal plan, having your breakfast between 6 and 8, when the potency of the insulin is great, and 5 to 6 hours after that, and then having nothing else, you don't have to have that middle-age spread. Yeah. You just don't have to have it at all. If you are a sedentary worker, if you work in an office, or even if you're a nurse walking around the ward, you really do not need more than 2 meals a day.
Yeah. Okay. Right. Question. Is a lot of women subscribe to the use of primrose, evening primrose? Mm-hmm. Does this work? And do you have clients coming in, you know, using this and talking about this? Does it work? Do you know? Does it help with menopausal symptoms?
Not personally. I've not known anyone taking evening primrose.
No, evening primrose. A lot of women tend to use that. I'm not sure how it works.
St. John's wort, definitely. Mm-hmm. But evening primrose, I know that it's normally used for ladies who are having a hormone imbalance, especially when they're still menstruating.
Yeah, okay. Yeah. Okay.
So I've not heard about it for menopause.
Okay. A lot of also a lady last week mentioned, don't know if you've heard about this as well, but mentioned using a magnetic wristband to help, that helps with general health, but does help with menopausal symptoms as well. I'm not sure if you've heard, if you have any information or know about this.
I think I can only speak from a personal point of view, Eve, having going through the menopause. Mm-hmm. And a lot of what Lucille mentioned is exactly what I've incorporated into, such as increasing water intake. Mm-hmm. Finding new hobbies is great. Eating a plant-based diet absolutely does work. And the 2-meal a day plan. Mm-hmm. And I know that when I first started out many years ago, I used to suffer a lot of hot sweats. I remember being in a meeting and I'm sitting there presenting, and then I could feel the beads of sweat just starting to pop out on my nose and my forehead. And I knew that I didn't want to continue that way because it can be debilitating. Yeah. Wearing layers, so you could wear layers of clothes, they start to take off each layer if you're getting hot. That I started doing, but I knew that there had to be an easier way out, and I chose totally the natural way. And that's why we're advocates for it, because it's worked, definitely worked for me, and I know that it's worked for Lucille, which is why we're doing what we're doing.
Okay.
And it's worked for many of our health guests as well.
For many of our health guests, absolutely. Lucille mentioned a recent one, and it has. So we've experienced it firsthand. Mm-hmm. I've never used HRT. I've never used any medication whatsoever. I haven't even used St. John's wort, I have to confess. Sage tea, definitely, and a lot of the herbal teas like red clover and stuff that is out there is what I've used. Yeah, I've not used anything like even primrose, red clover. St. John's wort. I didn't even want to touch HRT, but I know some women maybe they had to because it's debilitating. But I do know for sure that if they kind of gravitated towards the more plant-based foods, and eradicating caffeine is just a false stimulant. And you mentioned earlier that is there anything out there, you know, naturally speaking, to manage stress? You know, Lucille mentioned sleep. Sleep is so important, and it's important to try to get at least 7 hours sleep a night. That can reduce stress, but it can also help your body to produce the hormones it needs. And so there are many different ways to, you know, get rid of the fizzy drinks. You know, they dehydrate your body. The teas, the coffees, they also dehydrate the body, or sucks the moisture from your body. You need water. So water does help. Feeds your body, feeds your brain.
Yeah.
And sugars give you a false stimulation. So it raises you up and then throws you back down on the ground. So you're high, then you're low. You're high, you're low. And so certain foods can cause that reaction.
Yeah. I remember in our last session as well, another thing that was, I just remembered, mentioned by Pamela, was not having coffee, caffeine on empty stomach, because that does deplete the it doesn't help with the bone density. It weakens the bones. So that's another thing.
Yeah, not having coffee, period.
Well, yeah. So,
I mean, look, I'm speaking from a natural, natural medicinal point of view. Caffeine is a stimulant, and years and years ago, when I used to work at the office, you know, and there was coffee, and I decided to come off it. It was as if I'd smoked, you know, I smoked some weed or something. My stomach cramping, headaches. It was awful, and I never realized the effects of trying to come off the caffeine, which is why I do say that.
Yeah. And sorry, Joan, but added to that, I mentioned, you know, in order to have health, perfect health, there's 3 things we need: perfect circulation, temperance, and love, joy, and hope. Now, temperance is about avoiding everything that is harmful and using wisely, carefully that which is helpful. So coffee is harmful, yes. So we would recommend people come off coffee completely. Go on, if you're having symptoms, any of those 34 or all of those 34 different symptoms of menopause, and it's really debilitating your life, start eliminating those things which are harmful. And coffee, and anything with high amounts of caffeine, Red Bull, those things that give you wings, you know, just get rid of them. They're not helpful at all.
Yeah. Okay, thank you. And a question came in from a member of the audience. Well, like I said, I did you mentioned changes to skin and nails. You mentioned that earlier. Now, this person is asking, are there any natural products that can be used for dark spots on the face that's associated with menopause? Do you know of anything that they can use for dark spots?
I do know that if you use a base oil and or a carrier oil, I should say, and if they can get hold of frankincense, that is excellent for skin.
Frankincense.
For frankincense, the actual oil frankincense.
Okay.
And use it with a carrier oil.
Right.
And just maybe a couple of drops of the frankincense in a carrier oil. When I say carrier oil, I mean like sesame seed oil, jojoba oil. That's pretty good, or even plain simple olive oil. And if they use that on the area where they are having dark spots, that can help. Yeah, frankincense is an amazing skin nourisher, and great for the skin anyway.
Yeah.
And one of the approaches I would also ask this person is, has she got any dark spots on her tongue? Has she got dark spots on her tongue? So if she's got dark spots on her tongue, as well as dark spots on her face, it's an indication that she may have a vitamin D imbalance, and she needs to look at her vitamin D levels. So go and get a blood test and check to see if she's got a vitamin D imbalance there. Right. And if your doctor says it's fine, ask for the blood results, because many times they say your vitamin D level is fine and it is suboptimal.
Okay.
Right? So the vitamin D levels should be very, very high. So if they're getting those dark spots on their face, ask her to check and look at her tongue, see if she's got spots on her tongue as well.
Yes.
It suggests that she may have a vitamin D imbalance.
Okay. Thank you for that. Just a couple more minutes to go. We talk about menopause, and I think we literally address the beginning of the word. We address the word, but not the beginning, the men factor in there, which means something else. But for the sake of the partners, the husbands, the male partners of women who are going through menopause, sometimes it can have a negative effect on the relationship, because the man may not understand the changes in the mood. Or they may understand, but the pace at which the mood swings from happiness to don't come near me to something else, to, you know, and this minute I'm hot, put on the covers, take it off, turn on the AC, They can't understand that sometimes. What advice would you give to partners of women who are watching their loved one experiencing this and finding it really maybe difficult to understand the changes that the female body is undergoing, that's resulting in them acting and behaving in the way they are, whether psychologically or, just a total change in the behavior? How would you advise the men? Because I think sometimes we focus on the women so much about what we're going through, but it's having a negative. You mentioned dyspareunia. That can break a relationship when the poor woman is going through this, may not be able to articulate to her husband or partner to say, look, something's wrong here. How do we speak to the men to say, what advice would you give them?
To understand.
To help them understand.
But that is where
and so help them to understand and
no, it's about having that conversation and being honest, and sharing with them the effects that the menopause can have on their wife. And it really is for the men to kind of understand. I remember when we did a session on this, Lucy will remember, and there were some men in the audience, and they actually said the reason why they were in the audience is because they want to understand what their wife was going through or is going through. Yeah. So I think it's important that we tend to have sessions, and we tend to just say it's more or less, you hear about the menopause and it's mainly a female condition, but actually affects, if you're in a relationship, as Lucille said before, if you're in a relationship, it affects both the man and the woman, and or the husband, and both the wife and the husband. And so it's important just to have that frank talk and frank discussion, and so that the husbands can understand what they're going through, that they're not 25 anymore, and so there are changes to be expected. So it's having a frank discussion, because men change too.
Absolutely.
Men go through a form of menopause. It may not be physical, but it could be mental. They're reflecting on their past years. Have they achieved enough? And then they realize that they are becoming, looking older and becoming older, becoming more anxious, knowing that they're at the phase where they may, they may not have as much sperm as they used to. So men go through changes as well, and it's not highlighted as much as women going through menopause. So it's just having that discussion, that frank discussion between.
Absolutely, because oftentimes when men think, oh, a woman's going to go into menopause, that means they're going to have more intimate relations with their wife, and in fact sometimes it can be the reverse.
Yes.
So absolutely, if a man and woman are in a relationship, they should take the time out, spend time together, and talk frankly and openly about what's going through the woman's body, but also the man. He's getting older as well,
Yeah.
So yes, take that time out together, pause, and have that discussion.
Yes. Yeah.
Question from one audience member. I know we're wrapping up soon. How does the current isolation affect women psychologically? Are they coping more than men? Am I looking at the right? Yeah. Yeah. How does the current isolation affect women psychologically? Are they coping more than men? Can you relate this to menopause? Women going through menopause at this time. How do you think lockdown has impacted on women going through menopause? It's a general perspective, I suppose.
Very general question, and I think one of the slides, I think it was the one where I was talking about the between 50 to 60, and women find, you know, hobbies. They realize that they may be on their own in the home. Their children have thrown the nest. Maybe their spouse has passed away. Yeah. And how are they coping? It's difficult because we're in a season of COVID. It just depends on and what activities that woman will embrace and do. It's no different whether they're in lockdown or not. They'll still be living on their own. And so it is about finding those things they love or enjoy doing. There are women that go through, you know, going through the menopause. They're reaching, you know, they're pushing towards the age of 60, and some of them have actually picked up and done maybe another degree, or maybe they've gone to do more volunteer work, you know, volunteering work, or they go more radical and they try to see if they can tick things off the list that they've always wanted to do. And some of them may find the time to make new friends, albeit virtually, or pick up knitting or sewing, or going for walks, as Lucille mentioned. So it's about finding those things that are positive and that can bring a bit of positivity to their mindset, rather than you know, thinking more negatively and thinking that they're on their own. Whether it affects, you know, how does it affect men or women? You know, that is a very difficult question.
Yeah, I do agree with that. It's individual, isn't it? So it's hard to kind of generalize to say that, you know, yes, women. It's an individual reaction, Alex, and I suppose it's down to each individual. We've seen and heard reports of how the lockdown has impacted on relationships in general. Some people have gotten closer. Some relationships have been strengthened. Some relationships have been destroyed. There have been divorces. There have been increased domestic violence, increasing abuse, child abuses during lockdown. So if women are struggling, and this is just a general perspective, if women are already struggling to deal with their relationship, psychologically in the lockdown period, can you imagine the impact? It's compounded having to deal with the stresses and the psychological issues around menopause on top of everything else. Financial constraints and all kinds of things, children, homeschooling. And so it's very difficult, I would say. It's a very difficult one. It's a very difficult one, and it's an individual thing, so we can't really generalize.
Do you see the glass? It's about, do you see the glass
half full or half empty? So
it is definitely an important thing.
Yeah. Some people might even enjoy the isolation because the sweating and, you know, the hot flashes and the sweating and all of that. Maybe they just want time for themselves. So being at home might be good, especially in a way, you know, depending if they're on their own, so they don't have to be in public and the fanning and the this and the that and coping. So everybody's seeing what they're going through. So some people may enjoy the time away and the time on their own to just lock away and deal with whatever emotions or symptoms they're experiencing. So we can look at it from that perspective as well. Well, very good discussion tonight. We're going way over time. So I'm not going to labor on, but I want to say thank you so much, ladies and gentlemen online, for your comments, your questions, your good evenings, your hellos. Let me say hi to Elaine Foles, Alex, Gordon, Shika, Aubrey, Therese, Natasha Campbell, Shirley in Curlew, welcome. Nice of you to join us. Jean Hero, thank you. Charmaine, Lizzie Brown, thank you all for joining us tonight. Like I said, and I think Lucy mentioned this, that menopause is not a disease.
Exactly.
It just tells you that the years of your reproductive life as a woman has ended. It is not an illness, it is not a disease. And we all will have to face it at some point in time, some earlier than than others, some later than others. But at some point in our lives, we all have to face the music. Embrace it. Embrace it. Love yourself. Look after yourself. Use the opportunity to do things that you could not do because you may have been impeded because of pain and discomfort with your menstrual cycle and whatever other reasons or effects. But embrace the time. Embrace that period of your life.
Yeah.
You have matured. You've come to that age where things in your life may have changed. It's not the end of your life. It's not the end of enjoying life, but embrace it. Embrace it and use it as another opportunity to do something new in your life. All right, not a disease. Ladies, any quick, brief last words to the audience?
I love this stage of my life.
Mm-hmm.
Absolutely love it.
Yeah.
Yeah.
It's a period of liberation.
It is.
A period of liberation. Joan is enjoying it as well. All right.
Absolutely.
Thank you so much, ladies. Thanks again for sharing. I know, like I said at the beginning, you've had a busy year as well.
Yes, thank you.
Just ended your courses on yesterday, and thanks for taking time out to join and share with us.
Sure.
I have learned, and I'm going to go back and look at this video and write things down. So thank you so much, and Danila, I hope this gets back to you. I'll email you. Thank you so much for recommending the ladies to me. Thank you.
Thank you.
Yes, so end of season 1.
Mm-hmm.
End of season 1. This is episode 10. And I want to say again, thank you so much, ladies and gentlemen, boys and girls. Whether you're in England, the US of A, Jamaica, wherever you are, Africa, Europe, wherever you are, thank you so much for tuning in, for the interaction. Thank you for the comments, the questions, the feedback. I've made some changes and I've grown. I've seen myself grown through this process. Thank you so much. Thank you. It wouldn't be possible without you. And I'm thankful as well that this program has had some really positive impact on people. And that is what we're about. Say it loud. Put the information out there to inspire, to inform, to share, to educate, and to empower each other. Thank you.
Thank you
For joining us, for being with us for these 10 episodes. Some of you have been there from day one. I'm just really grateful. It's the little things for me that matters. And I'm thankful that you've been able to log on and interact. And the follow-up questions that comes days and months and weeks after. I'm grateful for that. All right.
Thank you.
I want to say happy Thanksgiving to the relatives and friends across in the US of A, on the other side of the pond. Happy Thanksgiving, and I hope you do have a very peaceful time with your loved ones. My condolences to those who have lost loved ones and friends during this period. But happy Thanksgiving. Have a peaceful one. And God be with you. Ladies, thank you so much.
Thank you. Thank
you.
you.
We'll see you again on Say It Loud next year, God's willing.
Yeah.
All right, stay tuned. And we look forward, Lucille and John, to having you again at some point in time. Thank you so much.
All right.
Thank
you.
you.
Bye-bye.
Thank you.
Thank you.